Steve Moran here with Senior Living Foresight, and I guess I feel so honored and privileged, Lori, to talk to you. So I'm talking to Lori Porter, who was one of 27 people in the whole United States to be on the nursing home advisory, the Presidential Nursing Home Advisory Committee, to talk about how to make nursing homes better in the aftermath isn't quite right because it's still going on, but in the in the COVID-19 pandemic, right? Did I get the name of the committee right, more or less?
It's the United States Commission on Coronavirus Commission on Safety and Quality in Nursing Homes.
Okay, I got it all wrong, but anyway, that's good enough.
And just one other correction: there were 25 of us, not 27.
Oh,
27 recommendations came out of a 25-person commission. So
okay, yeah. So that's a pretty special thing, powerful thing to be able to have your voice heard on a national platform like that. So I want to actually, the thing I'm sort of curious about to start with is I know you can't go into deep specifics, but just tell me about what it was like being on this panel.
Well, for me, it was especially exciting because, Steve, I don't know if you know it or not, but I'm a high school dropout, and I was on a commission with a whole bunch of PhDs and MDs and academics and nurses and a nursing home owner. And so, you know, it can be a little intimidating, except for when you're passionate. The people I represent, CNAs, they deserve me to do whatever I have to do to make sure people know about them and what their challenges are. And so I was very, very honored to have been selected in the first place, just me personally. It's the closest that I'm aware of in my 40-year career that CNAs have gotten to the White House.
So did you actually go to the White House?
No, sir, but I mean, this was a commission, you know, it came out of the White House task force. And, you know, a group of, I don't know, I'm sure you probably read it in the media. Yesterday, part of the commission was able to meet with the Vice President and Secretary Verma. And I understand that was a fairly robust meeting. We haven't been briefed on it yet. But, you know, that would have been a nice thing. But I was one of many who wasn't invited to that briefing. So I just look for the good. And I feel like that regardless what happens, I can say without a doubt that 25 commission members were united on staffing.
That is terrific. I confess that I have not read the whole report. It's about 175 pages or something like that. I have gone through all of the recommendations, and one of the things that's in the very front of the document is that I think essentially everybody agreed with everything, but I think there was actually one person who had sort of a bigger, broader objection, but generally speaking, everybody agreed, but there were 4 or 5 people who had specific points they had either reservations or objections about. And you were one of those people. And let's talk a little bit about what the areas of concern that you had, because I think I would agree with your concerns. So talk to me about that.
Well, I had to, you know, and I thought long and hard about whether I was going to fully endorse the report or endorse it with reservations was also an option, or not endorsing at all. And as you said, 13 endorsed fully, 11 of us endorsed with some noted reservations, and one of the commission members elected not to endorse the report at all. You know, 25 of us came from various different backgrounds, but the common goal was what united us. And so, you know, we got a lot of things right in terms of the workforce ecosystem. I am not ungrateful that NACA is actually mentioned in the final report a couple of times, actually. So I feel like that I was listened to and heard. by the overall commission, or we wouldn't have gotten the things in the report for workforce that we did. So we were all united. There was some specifics around what, funding or not funded. And, I maintain nursing homes cannot overcome this challenge of staffing before COVID, during COVID, or after COVID. And I don't know how you provide person-centered care without any caregivers for the person. And tonight we will. Last night we did. I was on with 50 CNAs on a video call 3 nights ago, and there wasn't a single CNA on that call that reported taking care of less than 22 people on their own. And they were from all across America. I can't provide person-centered care to 22 residents. I can't. It's impossible.
So how do we solve that problem?
Well, we solved that problem. Obviously it's not something we can solve overnight. There's so many complex issues, but the number one, we need to figure out what it is CNAs want. NACA knows that. I know that. Yesterday I was part of a training program where what astounded me was, after 26 years of being in the market space of taking care of CNAs and supporting them, I had 10 facilities go, "We never heard of you. How do we get our people involved?" My gosh, our CNAs need to hear your message. And I said, I know, I've been saying that for 26 years. But here's what I get into, Steve, is that I fall somewhere between, the facilities, the nursing home industry doesn't know how to take me, because they can't decide, wow, if we align with her, is she going to turn into a union? Well, number one, I can't turn into a union. If I am a union, I stink at it because I've never converted a facility to a union building in 26 years. I want to take care of CNAs, and that's what NACA's presence in long-term care has always been. And so we know CNAs. You'll look in part of, CMS came out with some things that they have done or doing in relationship to our report. I don't know if you've seen that yet or not, but one of the things they placed on there was, on the report that's for public information, was in terms of workforce, they said they created a toolkit for nursing homes in 2019. So it wasn't successful. What is a 2019 tool? It didn't work. If it was used, it didn't work. And whoever created the toolkit doesn't know CNAs. They have no idea. So yesterday on this presentation, these people that have been in our profession for years goes, I never thought of it that way. We do know what CNAs want. Unfortunately, it's not as easy as doing it. I got 90 minutes yesterday to explain it. And so I know you don't have that kind of time with me today, but CNAs need to be included. Here's something that is an eye-opener. You can't get administrator turnover rates in this industry, and you can't get DON turnover rates. But you can get everyone to agree anecdotally. I don't have any data to back this up, but you can get people to agree anecdotally that every time there's an administrator or a DON change in a skilled nursing facility, it sets the facility back about 6 months. There's agreement in that largely across the profession. And so trust. CNAs don't trust leadership, and they have good rights not to. By the time I get used to you, Steve, as our new administrator and trust you, you're gone. Right? Leadership, it is not about leadership anymore. Billions have been invested to make help nursing home administrators be better leaders. Nursing home administrators can't be great leaders by design. It takes every ounce of your energy to meet the minimum standards set for nursing homes. I don't blame administrators. I made some dumb mistakes as an administrator too. Here's another, my solutions are very, very simple. In that, for example, when I was a CNA, our regional, our corporate, that's who the big wigs was to us as CNAs, when our regional pulled in his Lincoln Continental and told us how important we were. And I'm jump starting my AMC spirit in the back lot as a 3 to 11 Nurse Aid Association. I got to jump it before I get out of the parking lot tonight. And he's here telling us how important we are. And what he would say, he might walk up to any one of us or tell us in a group, which is normally how CNAs are praised. And this is another colossal mistake. Education is mandated. That we put CNAs in a lane 40 years ago, and they can't be in a lane anymore. We're adults. The Gold Star attendance program doesn't work for adult women and men who are caregivers. People don't know them, so they don't know how to speak to them. So my regional would say, oh, Lori, I couldn't do what you do. Now, I don't know how frank I can be on here, Steve, but you know, what I heard, what the average CNA hears when someone like that pulls in a Lincoln, nothing wrong with him having a Lincoln, it just didn't look great to pull in and say, Lori, or gals, I couldn't do what you do. What we heard is, oh, you can't, frankly, how we said it is, you can't wipe a butt. That's what we heard. That's not what he said. That's not what he meant. That's what we assumed he meant, because we didn't have a high enough self-esteem and self-confidence to understand how awesome we are and were. What he could have said that would have made all the difference in the world, which is what they need. He doesn't have time to go around saying that all the time. So when he says it or she says it, it needs to stick. It needs to lift me off the ground as a CNA. So here's what the regionals could say, and it made the people in the presentations yesterday's eyes get as big as saucers. I said, he could have said to us, Lori, I couldn't do what you do because I don't have your heart. I don't have your level of compassion. Holy cow. You see?
Yep.
It's a fire and a miss all the time with administrators and CNAs, a fire and a miss. What do you want? We want this. Nothing ever sticks because CNAs don't even realize what they really want. We've come to understand this by having years on the front line with our members, with their supervisors. It's not uncommon for me to go into visit a nursing home and hear somebody say, trying to deal with CNAs is like herding cats. There's no wonder we have a staffing shortage.
Yeah.
And I felt like there was a director of nurses on the commission. There was a resident, as you know, on the commission. And so, you know, we felt some kindred spirits, those of us that have been on the front line and had lived it, are living it, see it every day. I'm in a lot of nursing homes pre-COVID, about 100 a year. And the things I witness are somebody's going to have to take responsibility for it. And I don't believe nursing homes can do it all on their own. But there are solutions to this. And I think just based on the two little examples I gave you, you can see why they're a little bit more in depth than being able to say, buy them a pizza.
So, Lori, let's talk a little bit about money. One of the things that you talked about in your press release that came out yesterday was you're calling for, and this was not in the report itself. This came from you and your organization, right? That you're calling for an increase to a minimum of what dollar rate per hour?
16. For the national average pay for CNAs today is 13 an hour across the country, and that needs to be moved to 16 an hour. And then I am a big fan of pay for performance. If you invest in yourself and you become specialized, certified in geriatrics, certified in infection control, certified in incontinence care, NACA has created these programs so CNAs can grow where they're planted. Most CNAs don't want to be nurses, and yet everybody thinks, oh, if they had the money to go to school and this, that, they'd become nurse. No, only about 6% of CNAs want to become nurses out of a passion to be a nurse. They love being CNAs. So I want to give them ability to grow where they're planted. So that would be the pathway then to the $22 an hour. You invest in yourself. Go ahead.
So, Lori, I love this because it's so funny to me. There have been calls for increases in minimum wage before, and sort of the response is the nation can't afford it, right? And yet, I find myself sitting back watching the impact of the pandemic over the last 6 months on the nursing home industry in particular. And I wonder, I guess I believe, and maybe you're going to contradict me because I don't think, but I think I'm right about this. If we've been paying $16 an hour in the middle of the country and $25 an hour on the coast where cost of living is more expensive, maybe it wouldn't have been as bad. We would have had more staffing. They would have been more enthusiastic. They would have been more higher trained. I don't know. What do you think? Do I have that wrong?
No, you absolutely do not. The facilities that we work with don't have any trouble recruiting people. We don't have any trouble at NACA recruiting. What we have a trouble is getting support across the nation for our programs. So my hope is, since NACA itself made the report, is CMS, HHS will reach out to us as part of the solution. Because we do know CNA speak. We do know what motivates CNAs. They do not. So I'm pushing for a national recruiting campaign. I'm pushing for a virtual one-stop CNA career center. We're working on that here at NACA. It's called NICE, the National Institute for CNA Excellence. And what we're hoping is the pillars under NICE will cover recruitment, certification, a national prep program, so you'll know the reality of long-term care. CNA certification course does not prepare you for long-term care. This is an industry of its own. And the whole sink and swim, that all needs to be dealt with early on, because there are people that will meet this challenge. Instead of looking at it as a curse, I look at the regulatory system as a challenge. So when CNAs, for years when I was a CNA, it was, oh, you'd meet your friends even oh, you still working in those nursing homes? You're still a CNA? And I never knew what to say. Finally, you'll just lie and say, oh, I'm a dispatcher down at the fire station, so people won't curl their nose up at you. And so, I finally learned that, and here's what I tell my members to say, I ask them, I'm old fashioned, so I still like them to look like a professional. I want those scrub starch. And they say, if we dress like you do and wear a stethoscope and all this stuff, people are going to ask us if we're doctors. I said, and we won't know what to say. I said, here's what you say. No, I'm not a doctor. I'm a certified nursing assistant at XYZ Caregiver or XYZ Care Center. I work in the most regulated business in the world. I'm more important than the doctor. The regulations say they only need to see him every 30 days. The regulations say they need to see me every day. I'm more important than the doctor. When we can teach CNAs to say those types of things and be proud of who they are rather than hiding and lying, we will have a different profession and a different industry overall.
I love that, Lori. Lori, thank you for so much for doing this. Thank you for serving. I appreciate you willing to share your insights. I love your organization. It breaks my heart that there are so many people who have no idea that you exist. So again, thank you very much for serving. Thank you for giving me some time.
Thank you, Steve. I appreciate it. Keep on doing the good work. We appreciate your contribution as well.